Hello, I'm Dr. Jerome Paulson. I'm a pediatrician at Children's National Medical Center in Washington, D.C., and I'm a professor of pediatrics at the George Washington University School of Medicine and a professor of environmental and occupational health at the GW School of Public Health. I also run the Mid-Atlantic Center for Children's Health and the Environment, which is a pediatric environmental health specialty unit. We serve Pennsylvania, Maryland, Delaware, Virginia, West Virginia, and the District of Columbia, and it's through that connection with Pennsylvania that I've become involved in this issue of potential health impacts of natural gas extraction using high-volume slickwater hydraulic fracturing from long laterals, which is also known as fracking. Some of the work that I do is supported by the Agency for Toxic Substances and Disease Registry and by the Environmental Protection Agency, and so they require me to tell you that they do not review what I say before I say it, and they also don't tell me what to say. So I want you to have some understanding of this process, and there are other videos in this series that will give you more information about the actual process of natural gas extraction using high-volume slickwater hydraulic fracturing from long laterals from clustered multi-well pads. And if I keep saying that over and over again, that's all I'll have time to say during this presentation. So I'm going to call this process unconventional gas extraction. I'm going to describe some of the toxicants that are associated with unconventional gas extraction and look at potential hazards that seem to be associated with unconventional gas extraction. Let's look first at children. I'm a pediatrician, and I think from a lot of environmental standpoints, children are more vulnerable, or at least are differentially vulnerable, than are adults. And if we use adult models in making environmental health decisions, in formulating our environmental health regulations, then we are unlikely to protect kids and may do things that really make no sense whatsoever as far as children are concerned. So on the one hand, I think it's self-evident that there are a lot of differences between children and adults. But as it relates to environmental exposures, children drink more water per pound of body weight, breathe more air per pound of body weight, and eat more food per pound of body weight than an adult does. So if the air or the water or the food are contaminated, then the child is going to get a higher dose of that contaminant than an adult will. Kids live longer than adults do. They have a longer shelf life, if you will. And from that standpoint, if there's a long lag time between the exposure and the adverse outcome, if I'm exposed to something today, and if it takes 40 years for that adverse outcome to occur, I hope I'm here 40 years from now. But for a 4-year-old or a 14-year-old, those kids will be around in 40 years if we've done everything else right, and so they're going to be alive in order to experience that adverse outcome. Finally, it's very important to recognize that we have to think of kids in utero, we have to think of kids in certain sense even before conception, as well as once they are born. It should be clear to everybody that children are not finished when they're born. There's a lot of growth in their body size, but there's also development of their brain, there's development of their lungs, and really every other organ system. And that starts at the time of conception, and clearly there are even some influences on the mother or the father that occur before conception that may influence the outcome with the child. But for example, if we talk about the lungs, the breathing tubes in the lungs and the alveoli, those little sacs where the oxygen goes into the blood and the carbon dioxide comes out, they continue to develop throughout childhood. So again, think about preconception, the embryo, the fetus, the infant, toddler, school-age child, and finally adolescence. All major times of change. We have some experience in society with exposures that occur in utero leading to birth defects or other later problems. So I think many people are familiar with the unfortunate experience several decades ago when mothers took a drug called thalidomide. In a very narrow window in their pregnancy, if they took the drug during that narrow window, their kids were born with without arms or legs, or with badly deformed arms or legs. Whereas if they took it at a much later time in pregnancy, there was really no adverse outcome at all. And so timing in utero is important. But there are also examples where timing at other points in life are important. Lead, for example, is a toxicant to children, and it's also a toxicant to adults. But lead primarily influences the central nervous system of children and primarily influences the peripheral nervous system of adults. So the same toxicant, different point in life, different outcome. And then there are other examples, for example, ultraviolet light. For Caucasians, 5 blistering sunburns prior to about 20 years of age triples their risk of developing malignant melanoma, which is the most serious form of skin cancer. And of course, that skin cancer may come in their 40s, 50s, or 60s, so long after this exposure occurred. However, in Caucasians, blistering sunburns after about age 20 do not increase the risk of developing malignant melanoma. So again, the same toxicant, ultraviolet light, different time of life, different outcome, and the issue with malignant melanoma then also serves as an example of that delay in onset of adverse outcome from time of exposure. So we know a little bit about these vulnerable periods in utero, the example of thalidomide, and others. Fetal alcohol syndrome is another example. We know something about these vulnerable periods in early childhood. We know almost nothing about vulnerable periods in adolescence, but clearly that time phase in an individual's life is another time phase of rapid physiologic and emotional change, and particularly self-evident in the various hormonal systems of the body, but in a lot of other systems as well. So this image is one of what goes on during pregnancy, and just gives you a sense of what point in pregnancy the various organs may be forming, so that if a child is born with a heart defect as a result of an environmental exposure, that exposure almost certainly occurred during the 4th or 5th week of gestation, and the exposure to whatever that toxicant was, had it occurred by, say, the 20th week of pregnancy when the heart is fully formed, would not have that same adverse outcome. And you can take a look at this image and get some other details as well. Same is true in the brain. In the brain and the peripheral nervous system as well, we have new development of neurons. We have movement of neurons from one place to another. We have synapse formation. We also have apoptosis, programmed cell death, that has to occur if the development of the neurologic system is going to be normal. And again, these things are all exquisitely timed, And if step B does not happen at the right time, then C, D, E, and F are going to be distorted and the outcome is not going to be normal. And this particular image again just reinforces how complex that ultimate adult brain is and these processes that occur at specific times. I've already mentioned very briefly the issue of lung development. So again, you have, as you can see in the small image on the upper right-hand side of your screen, the bronchial tubes, the trachea, and then the various branching of the bronchial tubes. And as a person grows, that system gets more complex and larger. And then, as you can see in the lower part of that image, additional alveoli have to form. We know, for example, as it relates to air pollution, that children who grow up in areas with higher rates of air pollution or higher levels of air pollution have smaller lungs when they're 18 or 20 years old than children who grow up in areas with cleaner air. The difference is not so severe that the kids with the smaller lungs have symptoms. They would never know that their lungs are smaller. But we also know that adults have some deterioration of lung function as part of normal aging that occurs every year. And so if at 20 you have less lung function than somebody else, what happens when you're 40 or 60 or 80 and you've lost function having less reserve to start with? Does that increase your risk of developing chronic obstructive pulmonary disease, COPD, or some other adult, so-called adult pulmonary disease that actually had its origins in childhood? In the endocrine system, of course, the development of the endocrine system influences the development of the fetus in utero, and then as boys or girls go through puberty, the endocrine system, of course, has a tremendous influence on the outward physical manifestations of puberty and also probably on many behavioral activities that occur as well. And as health professionals, we kind of know that as the Tanner stages that we use to demarcate movement through puberty. And we also know that it occurs in slightly younger ages in girls relative to boys, and girls also finish the process of puberty sooner than boys. So that's some stuff to think about children. Now, let's also think about some basic concepts in toxicology. The mere presence of a toxic agent is not in and of itself sufficient to cause problems. You've got to actually be exposed. Either that agent has to be inhaled, it has to go in through the GI tract, it has to be absorbed across the skin, or in certainly medical situations, it might get injected directly into the bloodstream, but that rarely happens outside of the medical setting. So you need to have exposure. That's item one. How much of the exposure, the dose, is also important. And I think most people understand the concept that the higher the dose, the worse the outcome, the more severe the outcome. The old adage that the dose makes the poison. And while that's true for some things, we now know that for a lot of environmental toxicants, in particular this class of that's known as endocrine disrupting chemicals, but even lead, sometimes do not have linear dose response curves. They can have a greater impact at lower dose and less impact at higher dose. So we need to keep that in mind. There is also individual variability, some of it probably genetic and some of it probably based on other factors related to susceptibility. Not everybody who is exposed to the same dose of a given toxicant is going to have exactly the same outcome. A very good example of that is if you look at the broad class of women who smoke versus the broad class of women who don't smoke. Women who smoke are more likely to deliver a baby with a cleft lip or palate. When you look at it in more detail, almost all of those babies with cleft lips or palates are in a subset of the women who smoke who have a specific genetic difference from other women, and it is that genetic difference in combination with the smoking, the genetic susceptibility, that leads to the development of the cleft lip or palate. And finally, the length of time of exposure is very important. In the real world of contemporary toxicology, we're not worried about somebody slipping a couple of grams of arsenic into an after-dinner drink, and then your opponent for appointment in the Queen's Court keels over dead. That's not the issue here today. The issue is a low-dose, chronic kind of exposure. Again, going back to the example of lead, which I think a lot of pediatricians and many other physicians and healthcare providers are familiar with, if a child is exposed to lead for months or perhaps even years in a home with peeling and flaking paint, the outcome is going to be different than a child who moves in for 6 months and moves out. So length of time of exposure is also important. In terms of basic environmental health principles, it's also important to recognize that being poor or being a member of a minority or racial ethnic group makes it more likely that you will be exposed to environmental health hazards and that you will have adverse outcomes as a result of those exposures. On a global scale, we know in foreign countries that the poorest of the poor are those who live in the trash dumps. Hopefully we don't have that situation here in the United States. But on the other hand, it is the poor and the minority groups in our country who live closer to hazardous waste sites, trash transfer stations, bus depots, and other places where pollution is high and common. So let's now turn and apply some of these thoughts to the situation of unconventional gas extraction. The process for unconventional gas extraction can be divided into about 7 different steps: pad construction, drill setup, drilling, the actual hydraulic fracturing itself, the natural gas extraction, and then when the well is dry, well decommissioning and hopefully ultimately land restoration to its previous status. From a health standpoint, I am primarily concerned about what goes on during drilling, during the hydraulic fracturing, and during the natural gas extraction. So I'm going to focus on those steps as I go through the next part of this discussion. So what you see here is a drilling pad that has already been constructed. You can see this open flat area with a bunch of trailers with a drilling rig set up on it. If you look over on the left-hand side of the image, you can see a small roadway that had to be constructed that allows truck traffic to go and come from the pad site. You can also see that this was plopped down in what has, until that point in time, been an agricultural area, because you can still see where the rows are going to be planted in the adjacent land. One of the things to notice in the lower part of this image is a large area that's reserved for wastewater impoundment, and we will come back and talk about that in a moment. I also want to give you a sense of how close this now industrial area of the well pad ends up being to homes, and the relative size of the well pad to these homes. So this picture is in a from a semi-rural area of Pennsylvania, and I don't know if you can truly make it out from the image, but the houses that are circled here are not small homes. These are not, you know, little 2-3 bedroom bungalows. These are relatively good size homes. But the well pad is much bigger than these homes. And then you can also get a sense of how close the well pad is. So in terms of lights that may be on the well pad 24 hours a day, 7 days a week, machinery that may be on the well pad and running 24 hours, 7 days a week, all trucks that are coming and going from the well pad. All of this industrial activity is happening in very close proximity to some homes. If any of you have ever used a drill at home, just drilling through a piece of wood, you know that, particularly if you don't hold the drill very well, that drill can create quite a bit of heat. And so when you're drilling through rock, I think it would be self-evident that you can create even more heat, and you need a way to lubricate the drill and dissipate the heat. And so that is done with what is called drilling mud. Basically, in most instances, some kind of liquid preparation, although occasionally compressed air is used, that is put down around the drill bit to help carry the ground up material away, to lubricate the drill bit, and to improve the movement of the drill down into the ground. So something has to happen to this drilling mud when the process is all done. And in some instances, it's trucked off site for waste disposal, but in other instances, it's buried on site and left forever. Sometimes the drilling mud contains many hydrocarbons, and then depending upon what it's drilling through in terms of the rocks underground, various other toxic materials can come back up with the drilling mud. I think that the drilling mud is primarily a risk to the workers on the site and not to people living nearby. However, if the drilling mud is buried on site, that is done with an assumption that nobody is going to disturb that site forever. Nobody is going to build a house next door and accidentally dig in, 100 years from now to what's a burial site for some drilling mud and release that contamination. And it also, the other way that the public can be exposed to the drilling mud and the hazards that are contained therein is when the drills do explode, which doesn't happen often, but does occasionally happen, and then the mud is spewed out beyond the confines of the drilling pad. So this is a little bit of a complicated image, and I want people to look at it in some detail. On the left-hand side of the image, near the top, you see a truck. And I'm going to talk in a few minutes about the number of trucks that must come onto the drill pad to bring water, chemicals, sand, and other material in order to get the drill to operate and the whole process of fracking and recovery to operate properly. But think about, when you're driving down a road that you may be familiar with and a large number of trucks end up using that road, what the implication of that is for the people who live near that road, and then we'll come back to this. A little bit closer to the center of the top part of the picture, you see an image of a pumper truck. And so when the chemicals are mixed together after the drilling is done, a huge pump puts these chemicals into the well at extremely high pressure, such that the rock can be broken up underground. And again, I'll come back and talk a little bit more about that. Then you see the well. This is after the drill has been removed, so you don't see that large superstructure above ground. To the right of that, you see a cutaway of that wastewater pit. To the right of that, you see a truck which is used then to move wastewater off-site. And then you see the tanks and the pipes that are used to collect the gas and send the gas to market. So let's look at the well bore itself. We talked about high volume slickwater fracturing from long laterals. If the gas is tied up in shale rock, which is down at the bottom of this image, think about it, shale rock, as a petrified sponge. So in the sponge, you've got all the little holes, but you know from holding a sponge that if you were to cut a hole in it, a little bit of the water would come out, but if you squeeze it, a lot of the water comes out. Well, this is rock hard sponge, so you can't squeeze it. You have to actually pulverize it underground. And if you only pulverize a small part of it, you're not going to get very much gas out. Pumping this fluid underground at very high pressure is what pulverizes the rock. But if you just drilled vertically and then just pumped water down, you wouldn't break up much rock. So you then have to turn the drill, and as you can see in the image, go out laterally. Well, this image shows the drill hole going to the right, but in the real situation, not only is there a drill hole to the right, there's a drill hole to the left, there's a drill hole going backwards, there's a drill hole coming out forward, such that if you looked at this from a bird's eye view in an X-ray to see into the ground, you'd have drill holes going out in the form of like daisy petals from that central area. And then you can see at the end of that lateral drill hole, what they basically do is put small explosive charges down there and set them off, and that's what fractures the rock. Then pump this water mixed with sand and a number of chemicals down there to continue some of the crushing of the rock. The sand acts as a stent, in medical terms, to prop open the small fractures that have been made in the rock. And then the gas starts to come back up above ground. When the furthest end of this drill hole is fractured, that's only right there. So then you have to go back and fracture a little closer, and go back and fracture a little closer, and go back and fracture a little closer. So you can see in this image there have been about 7 or 9 episodes of fracturing, and the average drill hole, to the extent that there's an average, can be fractured up to 10 times. Of course, as the gas comes back up, some of that water and chemicals that have been put down come back up also. And anything that was in the rock, in addition to the gas that has now been dissolved by that water or by those chemicals, come back up also. And that's where we get back up to the water in the impoundment pit and water that has to be trucked off site. So even before you start to recover the natural gas, you are doing a lot of things that contribute to local and regional air pollution. You've got the trucks that deliver equipment. You've got diesel generators on site. And we know that diesel engines, be they mobile or fixed, produce particulate matter, volatile organic compounds, and particularly the volatile organic compounds in conjunction with sunlight creates ozone. And so you've got basically local air pollution even before you have started the drilling process. If a particular episode of hydraulic fracturing were to take 5 million gallons of water, think about those 55-gallon tank trucks that you sometimes see on the highway carrying gasoline or whatever. You need about 3,000 of those trucks to bring that 5 million gallons of water to the site. You may have 40 or 60 sites in a particular geographic area. Excuse me, each one fractured up to 10 times. So for one episode of fracturing, it takes over almost 1,700 truck trips. If it takes 1.5 million pounds of sand to do one episode of fracturing, it takes about 750 truck trips to bring that on site. And so that's a lot of highway diesel traffic now in what heretofore has been a rural area. Then there is air pollution that occurs as a result of the natural gas once the drilling has been completed. Natural gas as used is methane, CH4, but natural gas as it comes from underground is methane plus other things, benzene, toluene, ethylbenzene, xylene, sometimes some hydrogen sulfide. And so as this material comes back from underground, for the first several days, that material is not captured. It's released to the atmosphere. Sometimes it's burned, and you can see an image of a picture taken at night when that burning was done. And even after the gas line is hooked up, there are ongoing releases of this material from the system. So it can be the gas coming from underground that provides the volatile organic compounds that are the precursors of ozone. The flaring of this produces particulate matter. Methane itself is toxic. And then, depending upon where the drilling is being done, Pennsylvania will be different from Texas, will be different from Wyoming, will be different from Colorado. Other things come up, some including radon and other radioactive materials. So again, in terms of the formation of ground level ozone, which is certainly hazardous to health, you need sunlight, you need oxides of nitrogen, which usually come from burning a fuel, you need volatile organic compounds, and then you've got ozone. And to look at the health effects for a second, on the right-hand side of this image, you can see the X's that link some of the adverse health effects to particulate matter, aggravating emphysema in children or adults. Aggravating asthma in children or adults. Emphysema, of course, is an adult problem. Increasing the risk of respiratory infections in children and adults. And particularly for adults, markedly increasing the risk of acute atherosclerotic vascular disease problems, myocardial infarctions, and stroke. And in terms of ground level ozone, airway inflammation, coughing, for those who have asthma, exacerbation of that asthma, and also increased risk of respiratory infections. So the studies that you see on this image are all studies that were done not related specifically to unconventional gas extraction, because unfortunately we have really very little data related specifically to unconventional gas extraction. But there are other studies of outcomes, looking for outcomes in association with exposure to benzene. And so the LUPO study, published in Environmental Health Perspectives in 2011, used a birth defects registry in Texas and looked at where moms lived during their pregnancy in relation to oil and gas refineries, and found that the kids who lived closer were at greater risk of being born with a neural tube defect, and showing an association, not a cause and effect, but an association between exposure to benzene and the subsequent delivery of a child with a neural tube defect. The Salama et al. Study from Environmental Health Perspectives in 2009 is a study that was done in France using a birth registry and then using geocoding how close somebody lived to a major highway as a proxy measure for exposure to benzene. And the women who lived during their pregnancies closer to the highway were more likely to have children who were lighter in weight, shorter, and had smaller head circumference for a given gestational age. In other words, they were small for gestational age, than were women who delivered children, or than were the children delivered from women who lived farther away from the highways. And the third study, Whitworth et al. From 2008, again published in Environmental Health Perspectives, uses a cancer registry in Texas and then looks at where the families lived prior to the time that the child got cancer, and again showed an association between living in an area with higher concentrations of hazardous air pollutants and the development of leukemia in children. Not a cause and effect, but just an association. I've alluded to the fact that these operations, particularly during the time of drilling, hydraulic fracturing, gas recovery, operate 24 hours a day, 7 days a week. And so that means during the drilling and the fracking, you've got generators, pumps, and other very noisy equipment running 24 hours a day, 7 days a week. And you've got lights on so that the workers can see what they're doing. Once the gas comes in and it's hooked up to the distribution lines, those pumps may run 24 hours a day as well, but they're a little more intermittent and they usually don't require the lighting. But basically, you've now created a situation that is very stressful, very likely to lead to sleep deprivation in people living close to these drill pads. And we certainly know, and I'll come back to this in a moment, that that can be associated with adverse health outcomes itself. We've talked about air pollution. We've talked about some of the stress from noise and light. One of the other things that people worry about, and for which you first really started hearing anecdotes about in terms of concerns about hydraulic fracturing, is water pollution. So we don't really know all of the components of what goes into these hydraulic fracturing fluids. But we do know that some of them are hazardous. We also know that the shale layer was created from an ocean millions of years ago. And so there are other materials left over from those oceans, a lot of salts and whatnot, that are locked up in that rock until the time that the water gets down there and then dissolves that and brings those materials back up above ground. You've got normally occurring radioactive material, which is sometimes abbreviated NORMS. And the question is, if you look at the bottom of this image where the shale layer is, that's about 5 miles below ground. So how does something from that level get to the water table, that thin blue line that you can see in this image underground, that may only be a couple of 100 feet below ground level? And it's not clear, to be quite honest, as to how that, if that happens or how it happens. But look very closely at the well site itself, circled in red, and you will see that that goes through the water table. So if the cement seal that's put in place around those pipes breaks or is not done properly, then it's very clear that things could leak out at that level. And then, of course, if the waste containment pond leaks or overflows in a big storm, or if materials leak from or intentionally are discharged to the environment from the trucks taking the water off-site, then again you can have contamination both of ground or of surface water. And again, I want you to get a sense of the scale of these containment ponds. So in the center of this image is a single containment pond. And then if you look to the upper slightly right-hand portion of this image, you'll see where I've circled a house. And again, this is not some small 2 or 3 bedroom bungalow. This is a pretty good sized house. And look at the relative size of this containment pond and the amount of water that it contains compared to that house. And if a leak occurs, that water is going to run downhill, and one of the things that's downhill is this house. I also want to point out these misters that are labeled in this image. Those of us who've worked in hospitals certainly have seen nebulizers for patients. We know about humidification systems when people are on external O2. And even just at home, we know about the use of vaporizers or humidifiers for kids when they have colds and whatnot. So these misters sort of do the same thing. They put moisture into the air, in this instance in an attempt to decrease the volume of fluid in the pond. But of course, if they're pumping liquid into the air, anything that's dissolved or suspended in that liquid, any pollutant, any of the volatile organic compounds that may be dissolved, any of the salts that may be dissolved, are getting put into the air as well. So this not only presents a potential of water contamination if this thing leaks, but it creates localized air pollution, and depending upon prevailing winds, that air pollution can be carried downwind for some distance. As I've said, we don't really know what's in the hydraulic fracturing fluid. Much of this information is confidential. A committee of Congress did try and gather some information a couple of years ago, and on this slide I've shown you the top 5 or 6 chemical compounds that they were able to identify. Methanol, isopropyl alcohol, the sand, the crystalline silica of course, ethylene glycol, some hydrocarbons, and then sodium hydroxide. But what I want you to do is get a look at this in a different kind of a way. So as many of you know and can review in other presentations from this series in more detail, the process of unconventional gas extraction has been exempted from the Safe Drinking Water Act, the Clean Air Act, and several other environmental laws in this country. So what these staff people from the committee in Congress did was they looked at some of these chemicals and said, would they have been regulated by these laws if these laws were in place? So, for example, on the first line here, methyl alcohol, if the Clean Air Act were in place, that would have been regulated as a hazardous air pollutant. And as you go down that column there, you can see that some of these chemicals are carcinogens, some of them would have been regulated as hazardous air pollutants, HAP, and others would have been regulated under the Safe Drinking Water Act, which is the SWDA. So I mentioned these naturally occurring materials that come back up from underground in the fracking fluid. Some of these are salts that were in the sea millennia ago that dried up and created this layer of shale. But then you also have the radioactive materials and the chemicals that were intentionally put in this fluid when they were pumped underground. There have been several instances of clearly documented groundwater pollution, Dimock, Pennsylvania, and Parker County, Texas. In particular, of course, if you go on YouTube, you can find hundreds of videos where people can light their tap water on fire. Not good scientific information, but you get a sense of at least how extensive the problem might be if all of these do represent groundwater contamination. And then there is this research on this image that I think is very, very important. This is research done by Osborne et al. From Duke University. It was published in the Proceedings of the National Academy of Sciences in 2011. And what they did was collect water from wells, plotted how far those wells were from drilling sites, looked to see if the water had methane in it. But the other thing that they did that was extremely important was they looked at the age of the methane that they were finding. And you say, how do they know how old the methane is? Methane that was formed eons ago has a different isotopic signature than methane that would have been formed in the last 100 years or so. And you know, when crops deteriorate in the field, when a turtle or a deer dies in the forest, when leaves fall from trees and degrade, of course, one of the products that is created is methane, and that may get into groundwater. So just knowing that methane is there doesn't tell you whether it came from a mile underground, from a well that was created, or whether it came from a couple of hundred feet underground that might be due to you know, deteriorating leaves or the carcass of an animal that died naturally or whatnot. But that's what they did. And so what you can see in terms of the circles on this graph is that the closer you were to an active drill site, the more likely you were to have methane, and this methane would be classified as old methane by the isotopic dating that was done. Early on in the process of unconventional gas extraction in Pennsylvania, one way of handling this water that came back above ground was to send it to publicly operated treatment works. That's no longer being done, and for very good reason. While the researchers at the University of Pittsburgh School of Public Health could not get access to the water that was actually being taken to these treatment sites, they could get access to the water that was being discharged from the treatment sites and the water in the river above the treatment site, so would not have had water coming out of the treatment site. And what they found is that the water downstream from the treatment site had very high concentrations of a number of ions: aluminum, tin, cadmium, calcium, lead, manganese, nickel, and on, that the water above the treatment site did not have. And so in all likelihood, these ions were from water that was brought supposedly for purification from the drilling sites, and of course the publicly operated treatment works could not handle this water. And they also found some organic chemicals like the benzene, toluene, ethylbenzene, and xylene, which could only come from the drilling sites. Now a lot of this water is pumped to disposal wells and just pumped back underground and left there. I want to touch on one other health-related aspect of this whole process. We in the United States are going after natural gas because when natural gas is burned in a boiler to create electricity, the amount of greenhouse gas that is released from that boiler's smokestack is less than if coal were burned to create a comparable amount of electricity. That's true. But what Anthony Ingraffia and others have looked at is how much greenhouse gas does the whole process of unconventional gas extraction create, and does that actually offset the reduction in greenhouse gas from that boiler? And we know that methane is a much more potent greenhouse gas than carbon dioxide, although it does not last as long in the atmosphere as carbon dioxide does. And I had mentioned already that sometimes for several days after the well comes in, it is not connected up to a collection system. And even once it is hooked up, there can be ongoing releases from that collection system. And in that initial flowback period, there can be several million cubic feet of methane released per day. And so Dr. Ingraffia and colleagues have raised this question about, are we really saving on greenhouse gases when we go to this method of recovering natural gas? And they believe that we are not. And clearly, climate change is the major public health problem, the major environmental health problem confronting us globally. So what I've said is that there are a number of either potential or documented exposures going on. There are pathways for those toxicants to get into human beings either through the air or through water. And therefore, I think we do need to be very concerned about potential adverse health outcomes occurring from this process of unconventional gas extraction. And I want to go back, as I said I would, and talk a little bit more about the stress that comes from this 24-hour-a-day, 7-day-a-week process, and also from the community disruption that occurs as people move in, move out, when rural areas are transformed into quasi-industrial areas and things like that. And one of the things that we know about stress is that it causes the release of hormones into the body, and we think that the release of these hormones may be associated with adverse health outcomes in terms of the cardiovascular system and the immune system in particular. We also know that sleep deprivation for kids and for adults results in adverse performance in school in the case of kids, and driving and in other activities that require concentration in adults. So this situation is something that, if unconventional gas extraction is going to continue, needs to be managed going forward. As I mentioned, I'm part of the Mid-Atlantic Center for Children's Health and the Environment. We are one of 10 pediatric environmental health specialty units in the country, and the units have come together to prepare some additional information for health professionals. This information is not covered by copyright, so you can feel free to download it and use it as you wish. There's one form for health professionals and another form for families. You can find it at www.pehsu.net. And this is the form for the parents. I work in Maryland, Virginia, West Virginia, Pennsylvania, Delaware, and the District of Columbia. But this, and I've talked mostly about my experience in trying to help people in southwestern Pennsylvania. But this is a national and, in fact, a global problem. There is known or potential for shale gas formation under 30-some states in this country. We have active drilling and hydraulic fracturing in Pennsylvania and West Virginia. There is and in Texas and in Colorado and in Wyoming. And as you can see from these pink areas on this map of the U.S., there are a number of other places where this could potentially go on throughout the country. And so it's very important for health professionals from all over to understand the potential risks associated with this process. So in conclusion, while we have no data documenting that there is widespread adverse health consequences occurring as a result of natural gas extraction using high-volume slickwater hydraulic fracturing from long laterals from clustered multi-well pads, we do know that a number of hazardous chemicals are used in this process. We do know that there are a number of very plausible and in some cases documented routes of human health exposure. And I believe very strongly that it is incumbent upon the drilling and the energy companies to demonstrate that they can do this process in a way that minimizes the threat to human and ecosystem health. And there should be a moratorium until they can document this to the satisfaction of the communities in which they want to work. We have some examples where impacted industries have set up pretty independent research mechanisms. The Health Effects Institute, which is partly funded by the EPA and partly funded by the automobile industry, has funded as well as has performed some really excellent research related to other aspects, motor vehicle related aspects of air pollution. In Canada, the Western Interprovincial Scientific Studies Association has looked at other aspects of gas and oil production. It is also the responsibility of these companies to fully release all information about all of the chemicals that they use and the quantities in which they use. And it should not be the responsibility of the public, as is usually the case with toxic chemicals in the United States, to fund research after the use to find out what problems accrue. And so for those of you in impacted communities, when you are confronted with patients who may have been exposed, particularly those who are children, you can turn to the pediatric environmental health specialty units that I've mentioned. We do come out and do lectures and presentations at grand rounds, noon conferences, and things like that. We cover a wide range of problems, not just unconventional gas extraction, and this list that you see in front of you is not in and of itself even an exhaustive list, but it gives you some idea of the range of problems we can help people with. As I mentioned, we are funded by the Agency for Toxic Substances and Disease Registry, which is part of the CDC, and the EPA through a grant to the Association of through a collaborative agreement with the Association of Occupational and Environmental Clinics. There's a PACU in each region of the country. You'll also see on this map that there's one in Canada and one in Mexico. They are not funded by the US agencies. They're funded by different mechanisms. And while you can't ask me questions directly now, you have my contact information here on the screen, and you certainly can, through PSE or directly, contact me, and I'd be glad to help answer any additional questions that you might have, and I thank you all very much.